Okay. Which of the following is the most likely cause of her nephrotic syndrome? A 30-year-old woman with a history of human HIV presents with generalized edema and recent weight gain. Laboratory tests reveal proteinuria, hypoalbuminemia, hyperlipidemia, and hyperlipidemia. Sorry. Renal biopsies performed show segmental scarring of some glomeruli. Which of the following is the most likely cause of her nephrotic syndrome? Okay. I would not say, firstly, it's HIV is the huge, like, that's what I need to focus on here. I would say it's not minimal change disease that's really found in children. Um, Membranous nephropathy, it could be that. It's a very common one cause of what's it called? Nephrotic syndrome, but I would say probably not, just because I think the answer is gonna be FSGS with segmental scarring in some glomeruli. So yeah, it doesn't have lupus, doesn't have IgA, so I would go with that.
Good. Yeah, for sure. The biopsy is going to be your best friend here, right? Um, some people kind of, they're worried about biopsy results, right? When they read a question, because they're like, I don't know what that means, right? Sometimes you just got to take a step back, kind of how you did, and you're like, oh, it shows segmental scarring of some glomeruli, which means focal, right? Diffuse means everything, focal means some parts, right? And so the biopsy is going to be your most specific thing here.
Sorry,
But
my dad is watering the windows right now. I'm gonna go tell him. I'll be right back. Sorry,
sounds
sorry.
good. Sounds good.
Okay, actually, I think he stopped. I think we're good.
Sounds good. Sounds good. So yeah, I was gonna just kind of say that. So just in case they ask, minimal change can happen in adults. I want to say it deals with is this some kind of lymphoma or something? I can't remember. Um, let me hold on. Let me see. Let's do the risk factors for minimal change disease. Can't remember. There's some specific thing that can happen in adults with minimal change, but I just can't remember age, prior infection, allergy. Oh, lymphomas. Yeah, that's what it was. So some
Okay.
cancers can cause you minimal change. The reason why I mentioned that is I've seen a question. It's super, super rare and super, super low yield, but just so you're not caught off guard, right? You have an older person, let's say in your 30s or 40s, that have some kind of leukemia or lymphoma, right? Then all of a sudden are starting to pee out a bunch of proteins, right? And so you might be thinking, oh, maybe that's membranous, maybe that's something else. That's a nephrotic syndrome, but it's going to be minimal change, just so you remember. So,
Cool. Good to
all
know.
right.